Well, now that Obamacare has survived the Supreme Court, what is next for Republicans?
Let's ask House Majority Leader Eric Cantor, who joins us live now from Washington. Good morning to you, Congressman.
Good morning.
So I know you're going to have a vote in the House coming up on July 11th. It will probably pass in the House to repeal Obamacare, but it's going to die in the Senate. So why even do it?
Well, Gretchen, what we've got to do is we got to continue to focus on seeing if we can get back to the health care that people in America want. And that's why we have scheduled a vote in the House to repeal Obamacare. And we're going to continue every day to try and make sure that we attempt to do that. But let's take a step back for a second and really think about what that decision yesterday means. It really underscores the choice that people have this election. It underscores the choice that people have in terms of the health care we're going to have in America, as well as many, many other aspects of leadership or lack thereof for the country. And so we're going to go in, try and repeal Obamacare. We're going to continue to try and focus on the kind of health care people want, which is patient-centered care. They don't want Washington coming in telling them what kind of coverage they should have or what their doctor can and can't do.
Sure.
That's why we're going to continue to fight.
Well, one thing the Supreme Court did, Mr. Cantor, is it said, hey, what are you talking about? This is not a fee, Mr. President. This is a tax, a gigantic tax on the American people. And the Affordable Care Act specifically spells out that the IRS will come after you if you don't pay your tax. Marco Rubio said that's just one more thing we're going to have to worry about, the IRS coming after us now.
Well, that's exactly right. I mean, the problem here, there are multiple for sure, but throughout the process when Obamacare was being considered, the President, Nancy Pelosi, and many others said, this is not going to be a tax. This is not a tax at all. Well, we saw yesterday the court then finally decided that issue and said, yes, it is a tax. We also heard the President consistently say that if Americans have health care they like, they can keep it. And we've seen that most Americans who have health care, they like it, they just think it's too expensive. And so what we're seeing now is Obamacare's forcing those people out of those plans. So yet again, a broken promise. And what we're saying is let's stop all the promises you can't keep. Let's get back to the kind of health care we want. Let's put patients and their doctors back in charge and stop Washington from meddling in this really personal decisions that surround health care.
And Congressman, the problem is, as you know, is you're not going to get elected if you think if you're running against Medicare, you're running against Medicaid, if you're running against Social Security, you're not going to get elected. People got used to those entitlements, and that's where they're staying. Do you fear that you're going to be trying to pull something back that's already slowly but surely being institutionalized?
No, because I think that people in this country don't like Obamacare. They don't want the government telling them what kind of health care they should have. They want to be in charge. And I also think, Brian, on the larger question of all these entitlements, I believe that the case we're making is supported by the facts. The math doesn't lie. We need to get back to growing this economy, stopping all the spending and the deficit spending that we're incurring, and get back to a growth-oriented future.
All right. Congressman Eric Cantor, thanks for your time this morning. I know you got a busy schedule. Have a great weekend.
Appreciate it. You too.
Majority Leader.